Hello everyone, hi, I am Jewel and welcome. Welcome to my channel. Happy New Year's to everyone. I hope that your guys' New Year's was very, very good. So guys, the article today is NKf Applauds new immunosuppressant drug coverage legislation to help save transplant patients from organ rejection. I have shared with you guys my challenge since October 1st, dealing with my own immunosuppressant drugs. The insurance have decided that they were no longer going to pay for my copay. So I have been paying it out of pocket, which from the Social Security office said that is fraud. But at the moment, there is nothing I can do because I need my drugs. And I'm letting them kind of sort it out at the moment. And hopefully, this article and what's going on will be a big benefit to all of us that are on immunosuppressants. So guys, let's get started. Washington, D.C., January 6, 2020. New legislation introduced today to extend Medicare coverage of immunosuppressant drugs for kidney transplant patients will not only save lives, but save taxpayers money. When patients cannot afford their medication, they often skip doses or are forced to make difficult choices, paying for basic necessities and paying for medicine they need to prevent organ failure. Guys, I can tell you that that is very, very true on a very personal level. The legislation introduced in the United States Senate by Senator Bill Cassidy and Senator Dick Durbin, and in the U.S. House of Representatives by Representative Ron Kind and Representative Michael Burgess, will extend immunosuppressant coverage past the 36-month cutoff currently in place to cover the medications for the life of a transplant. When a patient receives a kidney transplant, the body knows that the new kidney is foreign and will attack the new kidney and try to damage and destroy it. Taking life-saving immunosuppressant drugs suppress the body's ability to do this and helps prevent organ rejection. Skipping even one dose may increase the chance of organ failure. The National Kidney Foundation applauds the new H.R. 5534 bill and sincerely thanks Senators Cassidy and Durbin and Congressman Kind and Burgess for standing up for kidney transplant patients, and we look forward to working with them to advance this life-saving legislation. Two recently released reports demonstrate that extending immunosuppressant drug coverage saves significant federal funds over 10 years. On May 10th, the U.S. Department of Health and Human Services Office of the Assistant Secretary of Planning and Evaluation report shows that extending the coverage will result in an accumulated savings of approximately $73 million over the next 10 years. A May 23rd report from the Centers of Medicare and Medicaid Services Office of the Actuary shows that an even greater savings of $300 million over 10 years. So guys, this was the NKf Applauds new immunosuppressant drug coverage legislation to help save transplant patients from organ rejection. Guys, I cannot tell you how important this legislation is for people like me who have had a kidney transplant. And as you hear, from this article that they negotiated many years ago a 36-month cutoff of immunosuppressant drugs. So every year, we that have transplants would have to reapply, to get our immunosuppressant drugs for the next year, and so on and so on. So this is what we've been going through, and now the insurance companies have decided that they are not covering certain things anymore. So this is a very big breakthrough for us that are on immunosuppressant drugs, and I am very, very happy to see this, and very, very happy that the senators decided to bring this bill forward and to pass it for all of us that are on transplants, that all of us have had transplants, so we will not, suffer organ rejection. So guys, I am very, very grateful and very, very happy that there are so many people out there fighting so much for all of us that have had transplants to extend this bill for the life of the kidney that we carry. And I cannot tell you how grateful I am that this legislation is coming into being. So guys, if you like this video, please like, share, and subscribe. And as always, always, always sending you so much love and affection from this CKD patient, from myself to you guys, because I have been where you are. I know what you're going through, and hopefully for all of us, this too shall pass. Maybe not in this generation, but the next, because we have so much work to do to make this disease aware for people to know that you can stop this disease in its tracks by getting early diagnosis, checkups to make sure that you don't have the diseases, or the diseases like high blood pressure, diabetes, that will contribute to kidney disease. So guys, take care of yourselves. I love you all so much, and I'm wishing all of you a very, very happy day. So guys, I'll see you on the next video. Bye.